I've been asked to talk on know your numbers, how one should control the most essential risk factors like hypertension and high cholesterol levels. So let me tell you, the traditional risk factors for coronary artery disease, what we generally know as a cardiovascular diseases, are high blood pressure, diabetes, high cholesterol levels, smoking, inactive lifestyle. So these are all traditional family history. So these are all traditional risk factors for the heart diseases, and hypertension is one of the major risk factor which, if not well controlled, could lead to high incidence of cardiac attacks, heart attacks. It could lead to stroke, it could be peripheral vascular disease or chronic kidney disease. So it leads to multiple complications if blood pressure is not well under control. So when we talk about blood pressure, probably all of us are aware a figure of 120 by 80. So what we call is 120 is a systolic blood pressure, and 80 generally is the lower one, is what we call is a diastolic blood pressure. So probably most of us know these readings, that the blood pressure should be less than 120 by 80. So that what we call it is a normal blood pressure. So once the systolic blood pressure is more than 120 and up to 129, it is called elevated blood pressure. Stage 1 hypertension is called when the systolic blood pressure, the upper blood pressure, is between 130 to 139, and the diastolic, the lower blood pressure, is more than 80 or between 80 to 89. And stage 2 hypertension, if the systolic, the upper blood pressure is more than 140 millimeters of mercury and the lower blood pressure is more than 90 millimeters of mercury. So it is very important to know these numbers. We know only if my blood pressure or patient's blood pressure is less than 120, 80 is normal, but person who is on BP medication and they feel being 130, 140 is normal blood pressure for them, but it is not the case, because as we know, blood pressure is a silent killer. Having 130 or 140 BP for a longer time, probably people might not get any symptoms, but it keeps on causing a lot of complications within the body itself, and then that may lead to coronary artery disease, stroke, the kidney problem, and peripheral vascular diseases, and multiple problems. So even what has been realized, that more than 50% of the patients who are on the treatment for the high blood pressure will not have their target blood pressure readings. Means in spite of being on a BP medication, the BP readings are not to the target level, that is less than 120 over 80. So you should on a routine or regular basis keep monitoring your blood pressure, probably having a blood pressure apparatus at home, what we call is a electronic BP apparatus at home, checking your BP, making aware of what your BP readings makes more sense. And for this, the most important therapy is, first of all, is the heart healthy lifestyle, which includes low salt diet, what we call is a DASH diet, a dietary approach to stop systolic hypertension, which includes diet which is high in potassium and calcium, will help people reduce their blood pressure naturally. Eat a lot of fruits if permitted. If potassium is not high, if you are not a kidney patient, then only this diet is very, very appropriate. And importantly, avoid excessive salt, no add-on salt in your diet.
If you found this video helpful, don't forget to give it a thumbs up and share it with your friends, and leave your thoughts in the comments below. And of course, subscribe for more content on health and lifestyle.